Thank you, Mr. Chairman, and I'm glad I got here in time. Welcome, all of you. Thanks for joining us and for the service you provide to so many people. And it's more important than ever. I mean, we all living through the pandemic, we're all saw different parts of the healthcare system, perhaps, and it's more important than ever that people in my state and Nevada and Oregon and Idaho get the mental health care when they need it. We know that we didn't pay enough attention to mental health during the pandemic. Mental health, it's fundamental basic health care. It works, it saves lives. Too many families, though, as you know, can't get this life-saving care. Finding someone to help is hard enough. Trying to call for an appointment with a doctor who doesn't exist or doesn't exist at this number and is a so-called ghost. We agree we spend too much time trying to schedule doctor's visits. For most people, it's far too troubling and difficult and Rube Goldberg-like to get through. The problem worsens when we can't be sure that the doctor listed in the insurance directory is actually practicing medicine in the place that we think that person is. And doctors listed aren't taking patients sometimes. Other cases of doctors have retired or practicing in an altogether different location, sometimes in a different state. I mean, it's infuriating. It's also preventable. So, Dr. Tressman, what should Congress do to make it easier for you to work with plans to make sure they have the right information? How would you feel if you tried to call a doctor only to realize the number? I mean, you know where I'm going on this, so talk to me.
Thank you, Senator. You know, to be very trite, this is complicated. There are many, many opportunities, but I do think some of the things we've heard today are really critical. The first, if Congress could pass a standard that everyone shares to reduce the inconsistencies in format and reporting time and sequence, the more we can have consistency and essentially interoperability, making it electronic, making it as close to real time as possible would be of enormous benefit to everyone. So I think that some of the things that Dr. Rideout mentioned in one form or fashion could be transformative for our nation if we have a standard. That would really reduce some of the challenges. Sharing the burden between the physicians and the insurance plans so that, you know, we own responsibility of, you know, how many patients can we see? You know, how much can we afford to see of which plans? So, but I think that a standard that would be federally structured and guided would help all of us. Thank you.
Thank you, Dr. Ms. Meyer, kind of along those lines, let's continue down that path. First, thank you for sharing your story to this committee. That always takes guts to talk about personal stories in public and Congress. No one should have to fly, of course, no one should have to fly across the country at her own expense because she can't find a psychiatrist to treat them. Ohioans just want to get the treatment they need using the benefits that they actually paid for. Several years ago, we passed a law making sure patients are held harmless when they relied upon an incorrect insurance directory. Sadly, patients must file an appeal with their insurer, the same insurer that made the error. Ms. Gilliberti, isn't this appeals process just one more annoying, time-consuming, I hate to use the word Rube Goldberg again, but kind of is a hurdle that Ohioans and others shouldn't have to face when they want to get mental health treatment?
These kinds of processes can also be very difficult for people. So we talk a lot about making sure people know their rights. It's clear. You know, we've been talking about financial protection. If you use somebody in a directory, you know, that should be really clear to you that you have a right to get that reimbursed. So we need to make things clear to people, and I agree that a lot of these procedures wind up making it difficult for the person and the insurance companies really need to bear the burden here.
Thank you for that, Mr. Chairman. Thank you.
Thank my colleague.